Hi, I'm Elisa Bronfman from the Family Medical Coping Initiative. I'm here with my colleagues, Annie Banks, the social worker from our team, and Gail Windmueller, the child life specialist from our team. The Family Medical Coping Initiative focuses on helping children and family cope with medical interventions. Today, we're going to talk about the topic when medical care leads to traumatic stress, and we're going to give you tips to help yourself and your child. We hope that our talk today is both practical and gives you some helpful ideas of what you can do to both recognize traumatic stress in a medical setting and help your child cope with it and perhaps prevent it. That's our mission. So, knowing that medical care is essential, it's essential for your body, for your health, it's needed. But at times, it is hard for children to have the medical care that they need to keep their bodies healthy. Shots can be scary, medical tests can be scary. So, with that in mind, we'd like to think about ways to make those things less scary for kids and less stressful for you. So, our agenda for today is to start with a definition of traumatic stress and about ways to help your child when there's traumatic stress in a more general way. And then we're going to move to why medical care can feel traumatic to a child and a family. We're going to talk about preventing some of the trauma and the stress. And also, we're going to talk about recognizing when your child has some signs and symptoms of traumatic stress and what to do to help make it better. With that, I'm going to turn to my colleague Annie and ask Annie, what do we mean when we talk about traumatic stress?
So thank you, Elisa, for that question, because it's really helpful to first get a little understanding of what traumatic stress is, how it's different than other kinds of stress, and how our bodies and minds respond to traumatic experiences before we think about how trauma can be related to medical care. So trauma is a word that people use a lot these days to describe experiencing something scary. But a traumatic experience has very special qualities. Trauma is an experience that is deeply disturbing or distressing, in which the person experiences the threat of being harmed. And that threat can be very real, or the threat can just be a perception of threat, but the body and mind respond as if the threat is very real. And a traumatic response can be to a single event like a car accident or a natural disaster, for instance, or by repeated exposure to seemingly stressful, threatening situations kind of over and over again. So let's think about how stress works in our bodies and our minds. And it's important to remember that stress is not always a bad thing. Our response to threat evolved to protect us. So, how would you respond if confronted with this in your path? It's important to remember that our nervous systems have been designed for survival. And when confronted with a threat like this, we kick into the fight, flight, or freeze response. So we'll get an automatic burst of energy. Many systems in our bodies will automatically ramp up to fight the bear, run them from the bear like we have never run before, or stand immobilized, which is the freeze response. And this is a stress response designed to save us and protect those we love in the face of perceived danger. But with a traumatic response, stress response, the nervous system, it doesn't cool down, or it rapidly moves back to this kind of response when confronted with, or even just thinking about a threat, or perhaps just kind of in general, thinking about the world and the nervous system ramping up again for this kind of response. And many studies have shown that traumatic stress can actually change the way the body functions in a permanent way, and the way the traumatized person perceives the world around them in a more long-term way. So I'm going to give you a quick example from my life. I was in a car accident many years ago, unfortunately. And whenever another car, when I'm driving, whenever another car gets close to me on the road, my nervous system kicks into overdrive. On a conscious level, I don't think this car is going to hit me, actually. But my body and kind of my deeper thoughts respond as if it might. So even if the car is like 4 or 5 feet away, sometimes I feel like it's right up next to me. and get this kind of traumatic stress response. So what does that kind of response actually look like? So the body tenses up, the heart starts beating very fast. There can be shaking, sweating, fast breathing. It can be hard to think because the body's putting all of its energy into mobilizing in some way. Sometimes there's irritability or anger or panic. And sometimes even, away from the situation, there can be chronic worrying or depression. As I said, kind of a sense that the world in general might not feel like a safe place. And there can even be spacing out, which is a kind of freeze response we call dissociation. So for children, these experiences can possibly affect them into their adulthood.
Gosh, Annie, so what protects a child from traumatic stress?
Well, I've painted all doom and gloom about traumatic stress on the body. But fortunately, there are a lot of things that protect kids from developing a traumatic stress response. And one of the best things that kids have going for them is that their brains are growing and forming and kind of flexible. And so when they have lots of other good positive experiences in their lives and a sense of safety in other ways, that can really help protect them. Also, having a sense of hope and optimism and belief in their future, thinking about what they want to be when they grow up, those kinds of things are just really helpful. And their ability to manage their emotions and behaviors, as well as a sense of control and mastery for important, like age-related activities, such as learning how to read or learning how to ride a bike or tie their shoes. Um, all of these things help protect kids and give them a sense of control. The most important thing, of course, is having a secure, stable, and safe relationship with at least one nurturing adult, and having relationships with all kinds of other people, positive relationships, whether it be at school, in the community. These are all significantly protective factors against developing a traumatic stress response. So I'm going to turn to Gail and ask, why can medical care feel traumatic to a child?
So that's a really great question. And you really offered a great understanding of what trauma is and what the traumatic response is. In a medical setting, there are 5 aspects of medical care that can contribute to potentially being traumatic. And these include, first, the environment. Second, the reason the child needs medical support. Third, the beliefs that the child has. Fourth is the fact that children think differently than parents and adults. And lastly, the things that children observe or hear from the adults around them can contribute to medical trauma. So I'm going to talk about each of these separately. The first one was the environment. So the environment at home is very peaceful and calm, and kids feel very comfortable. They're used to it. They have their pillows and their beds and their toys, and everything's very, it's something that they're used to. When they walk into a medical office or a hospital, things are usually much more stark. There's often white walls. There's equipment that they don't recognize. There's beeping sounds. There might be different smells that they smell, unique smells. There's also, if they're in a hospital setting, they may see other people who are sick or other children who are sick or injured, and that can be very difficult too. So the other issue, the second thing I mentioned was why your child needs medical help. And one is if they're in pain or discomfort. Kids don't feel like they have control in the situation when they're in a hospital or a doctor's office. They know that they're there for a reason and they don't know what's going to happen and they can't just get up and walk out. they're also not sure what's going to happen to them. So it's confusing. Are they going to get a poke? Are they going to be looked at or touched in a way that's uncomfortable? And also there's different food, there's less sleep, and there's not a chance to like exercise or run around outside, which they're used to doing. The third category or aspect of medical care that can potentially cause trauma is children's beliefs. And most children feel safe and secure at home, and they know that their environment at home is okay and that they're safe. But when they walk into a medical office or a hospital, they feel like their world has changed and they feel powerless. And they don't feel that same sense of security as they do outside of the medical environment. And they may feel worried about dying or something bad happening to them. They also may feel disoriented because they're not following their usual schedule, like getting up in the morning, going to school or daycare, going to sports or playing with their friends outside. They don't have their usual family life. And so those all can contribute to kids developing trauma in a medical setting. The fourth category that I mentioned was that children think differently than adults. And young children who are in elementary school or younger tend to hear words and believe them literally. So if they hear that they're going to get a CAT scan, they may actually associate that with cats. And rather than a CAT scan being a machine that you go into and there's pictures of your body that are taken, so that the doctors can see what's inside of you and if there's any issues that are going on inside. So it's really important to be careful about what we say to children because they do take it literally, and they can misunderstand a lot of things that are said and things that are going to happen to them. They're also, most kids are taught from a young age to be very cautious of other people touching them or looking at them. So a lot of times there's confusion about, when it's okay touching versus not okay touching. And in the doctor and in medical environment, there are times when they have to be looked at in places that might be uncomfortable for them or touched in ways that are uncomfortable. So that also can contribute to medical trauma or any kind, to trauma. Now, the fifth category was observing and listening to the adults around them. And it's amazing how children can sense how their parents are feeling. Even babies, when they're held, if their parent is tense, a lot of times babies will start to cry or, just become agitated. And it's amazing that they can sense this even as a very young child. As kids get older and they're even more observant, how their parents are reacting to situations can make an incredibly big difference. If they see their parents are upset or they see the medical team are concerned, they may worry that something big is going on and something, sometimes parents get really upset over like just having to give their child medicine. But the children don't recognize that the difference between their parents upset over a little thing versus a big thing. Another thing that it's important to remember is sometimes people around kids will say things, for example, like, come on, you're not that badly hurt, or look at the other child over there and how they're behaving. They look much more hurt than you. So these kinds of comments aren't helpful to children. They actually can increase trauma that children are experiencing. It's sort of like adding salt to a wound. And it just makes things worse. So it's really important to think about what you're saying to your child and how you're saying it.
Yeah, thank you so much, for sharing kind of being in a child's mind, right? And showing us kind of what the medical environment or medical care can look like to a child and how it can be feel threatening for them. And also thanks for talking about parents and adults kind of not meaning to, but sometimes adding to the fear I think we as adults often bring our own fears from our own experiences as children having medical care, possibly. We don't even know that we're bringing that in, and it can really make things harder for our kids. So I really appreciate you talking about that. But on a more hopeful note, I say, what can we do to prevent traumatic stress in a medical environment?
Well, there are actually a lot of things we can do to prevent medical stress. And one way to look at this is going back to the 5 things that potentially can cause medical trauma and sort of dissect what can we do about each of those issues. So when we go to the first one, the first thing was the environment that we talked about. And one thing you can do is we talked about how home was a place of comfort. And so if you can bring a piece of home with you to the hospital for your child, that can make them much more comfortable. So bringing a favorite stuffed animal or a blanket or a toy, and for older kids, bringing a game that they enjoy just to be a distraction and sort of make it not feel so different from home. If they can be playing cards with you like they often do, then that will feel much better than if they don't have anything that they're used to doing. So bringing pieces of home with you is very important. The other thing that can be very helpful is preparing children for medical experiences. And this is in general, we call this medical play. All children, it would be helpful for them to have an opportunity to play with medical things. We recommend children having a play medical kit. They're available at local stores or online. Some of them are as inexpensive as $10. You can also add cotton balls and Band-Aids or one of the oral syringes that comes with medicine for infants. That can be sort of like a pretend shot. And allowing your child to pretend to be a nurse or a doctor with a stuffed animal or a doll or even you can help them learn about what medical treatments are all about. So kids learn through their play, and this is another opportunity for them to learn about the equipment. Even though it's play equipment, they can be reminded, oh, remember we talked about the the stethoscope that you were playing with at home that we listen to the heart? That's what the doctor's going to do now, is listen to your heart. So just making the connection for them with the play that takes place at home can be very, very helpful and can help reduce the possibility of having a traumatic response. There are lots of ways to prepare your child for going to the hospital. There are books and stories, and I'm going to share out those with you at the end of our presentation. In addition, we have other webinars that we've presented that go into more detail about a lot of the things we're talking about today. So I'm going to continue on to the next aspect that can contribute to medical trauma. And that is, why is your child getting medical support? And it's so important for your child to understand what's going on and to be very honest with them and use simple words. It's important to consider how old they are in terms of, the wording you're using and what you're telling them. Also consider the timing. If they're just getting if they're starting to get sleepy and they're going to fall asleep, that's not really the time to start telling them about what's going to happen. It's nice for them to be able to take a nap. And it's important to use very simple words, especially for young kids. For example, for a young child, you might say, if they come in with stomach issues, you might say, the doctor said you have a boo-boo on your belly, and they're going to fix it so you feel much better. That will help them feel secure about the fact that you know that the doctor's going to help and that they're going to get better. You can also help increase your child's sense of control through realistic choices. Now, realistic choices are choices that you give your child where you're always happy with the answer. So, for example, if you say to your child, can I take your blood pressure or can I give you a shot? The answer is always going to be no. But if you ask your child, can I take your blood pressure on your right arm or your left arm? That's a realistic choice because we can live with either of those decisions. If they say my right arm, that's great. If they say my left arm, that's great. So those are realistic choices. And whenever we can incorporate that into our visits in the hospital, that can be very helpful. If you know you're going to an appointment in advance, you can also call the doctor's office in advance and ask them what's going to happen so you can talk to your child about it. And you can also ask if there's going to be any mental health professionals there, like a social worker, a psychologist, or a child life specialist that might be available if you find that your child's getting anxious. That way you can say, you know, I understand that there's people here that can support my child and I can tell they're very anxious. So can someone come in and help? The third thing that I mentioned was children's beliefs. And we want to help them make it feel like their world is still safe. And we can do that by reassuring your child that you'll stay with them or someone they know will be with them while they're in the doctor's office. That can help reduce or prevent trauma. Tell them that the people in the hospital are there to help them make them feel better, that they're helpers and they want to help them get better. And you can also advocate for your child. You can, if you notice that your child's in pain and no one else has noticed, you can tell them that your child's in pain and ask for medicine to help them. And if they need to get an IV or any kind of poke, you can also ask the doctors or nurses or mental health professionals if there's things they can do to make the child more comfortable during this. And there are many things they can do. And one of our webinars talks all about that. So I'm going to share with you which one it is later on. The fourth reason that we talked about was children thinking differently than adults. And you can know one of the issues that we have sometimes is we don't know if your child understands what's going to happen. And one way to find out if your child knows what's going to happen is just to ask them if they're at an age where they can talk to you. You can say, so the doctors and nurses explain what's going to happen. Can you tell me back what's going to happen to you? And that way you're sure that they really understand it and they didn't misinterpret something that was said. And I have a wonderful, it's a theory example, but it's a great example of how this was caught and it avoided a child being traumatized. There was a child life specialist working with a young boy who was 5 years old, who was supposed to get a kidney transplant. And she did some medical play. She brought out a doll and some pretend medical equipment and some Band-Aids. And the little boy was focusing on the doll's knee. He was putting Band-Aids on the knee. He was listening with the stethoscope to the knee. He was giving shots to the knee. And the child life specialist said to him, so can you tell me what's going to happen? What's going on with your doll? And the little boy said, my doll is getting a brand new kid's knee, just like me. So how about that? This child thought he was going to have surgery on his knee and not on his, what we know as adults is a kidney, which is in your abdomen. And imagine if this child had woken up thinking he was going to have a surgery on his knee, ended up with a big incision in his stomach instead. So here, this was an opportunity for the child life specialist and the parents to talk to this little boy and explain what was actually going to happen so that he wasn't traumatized about this event. It was a hard event, but at least he understood what was going to happen. And that really, really helps. And then the last thing that I mentioned was observing and listening to the adults around them. So one thing that we all understand, it's incredibly difficult to have a child even go to a regular checkup because you're worried that something's going to come up that's wrong or that how your child's going to react. And if you're in the hospital, it can be even more scary. But it's really important for us as adults and as caregivers to try to control our emotions. And ways to do that is to do deep breathing, relaxation exercises, thinking about positive things, getting a drink of water sometimes can help. And if there's someone else in the room that the child knows, asking to step outside and get some fresh air and just get away from the situation can help you to relax. And using all of these strategies as a caregiver can really help reduce the chance that your child will have a traumatic experience while being in the hospital or the doctor's office. So now I'm going to turn to my colleague, Elisa, because I know a lot of you are worried about has my child been traumatized, and how will I know? So Elisa, can you share with us the signs and symptoms of medical trauma?
Oh, sure. Thanks, Gail. And I was so fascinated by the CAT scan and the idea that a child would think that had to do with cats, and the kid's knee, and thinking that it was a knee, not a kidney. Those were really interesting examples. And I just wanted to add on that one that I have seen frequently is kids when they're very worried about an upcoming intervention or an appointment. It's often good to try to get to understand why they're worried about it or what they think about it, because they can have misconceptions about what's going to happen. And one of those misconceptions that I've seen is when kids are told they're going to have a surgery or an intervention of some kind, and they're going to be put to sleep, and they've previously seen a pet potentially put to sleep, and they're very frightened about what that means, being put to sleep. So I think, again, just really being very cautious and careful when your kids are upset or worried about an upcoming intervention, really remembering and thinking, what do they think is going to happen, and do they truly understand what the real story is? So thank you for those stories. And yes, we do really want to look for what are the signs and symptoms of both anxiety, and even if it doesn't reach the level of trauma, the question of if kids are anxious or sad or worried or traumatized about something that has happened or is going to happen in a medical setting, we want to figure out how you could recognize it. And the first thing I'll say is, even from infancy through young adulthood, caregivers and parents really know their children, and you know how they typically act and what they typically do, and to use that knowledge and trust your own intuition about when there's a change in your child's everyday functioning. So even when they can't talk, sometimes people can tell when an infant is ill by their behavior and how it's changed. So kinds of things to sort of really pay attention to are: how are they sleeping? How are they eating? How are they doing their regular activities? Are they playing as they normally do? You want to look at their skills. For example, we have the toilet picture here, which is sort of to represent the skill of toilet training. But if your child wasn't toilet trained before, it wouldn't be a change for them not to be toilet trained after. But if you see a change where they were toilet trained and are now having accidents or troubled, or similarly, they were able to get dressed and now they're struggling with that, those are really important to pay attention to, their day-to-day functioning. But I also like to say, what are they saying and what are they playing? So if you notice that the kinds of things they're saying are different than what they normally say, like everything is hopeless, or I always lose, or if they're asking questions about dying or illness, those are important to pay attention to. And Gail did a really great job of sort of talking to you about how you can use play to recognize and help kids prepare for interventions, such as with the medical kit. That same medical kit, if they're playing with it and they're demonstrating doctors and nurses and medical techs being very gentle and using a stethoscope, for example, to listen to your heart so they would help you understand your body, that's one way of playing. But if they're playing with a stethoscope and it looks a little more like a weapon, that gives you some indication of how they might be feeling about medical interventions. And there's also some particular things to pay attention to notice your child's distress. One is nightmares here. This little boy looks like he's in trouble from nightmares. If they're having more nightmares, or the nightmares are specifically about things in the medical world, I'd pay attention to that. And similarly, this little sad girl, obviously, if your child is sad more often, or often in children, they actually have more tantrums, or more irritable, that's important to pay attention to. And again, at every age span, in the way that that child acts. So if a teenager is just more reclusive and not with you as much, or in their room more, again, pay attention to it. And it's important to pay attention to every age that your child is. And it's also important to pay attention to it for yourself. So you might notice that if your child has an upcoming intervention, or that you were affected by something that happened, and you notice a change in your own sleep, your own eating, your own mood, important to take care of both yourself and your child.
Those are so interesting. That's great to know. You know, if you see these, but the thing is, as a parent, you know, if you see your child going through these things, is there anything you can do about it? Like, what can caregivers do if they see their child is showing these signs and symptoms of medical trauma?
Yeah, I think the first thing to do is, so we're talking about with ways you notice if a child is anxious or distressed by the change in their daily functioning. And another thing to do is actually to try to reestablish their routines of everyday life. I know when a child's gone to the hospital or gone to the doctors or they've had something done that was hard for them, we like to reward them with maybe staying up late or a prize or missing school. And there's a place for that. I'm not saying that there's no place for that. But if that goes on too long, it can signal to them that that was a really hard thing. And also, they miss out on the regularity of a predictable routine and schedule, which is often very reassuring to kids. So sometimes it's not a gift, as I think all parents know. To let them stay up late is sometimes not a gift for children at any age. They're tired the next day, they're irritable. So even though you want to give them something, think about reestablishing that routine, getting them back to school, work, or preschool, or wherever they are in their daily lives, getting them back to their routine is important. But it's also important to take advantage of community connections. So, here we have kids. I'm not exactly sure what these tweens and teens are doing, but I think maybe they're making a fire, but they're all together. That idea of being back with friends, being back with other people, because the other people in the community who are their friends or who are your supports may be slightly less affected by by whatever medical intervention happened because they weren't as close to it, for lack of another word. And also, there's something about happy other people or other people who are doing what they're supposed to be doing that can be contagious and pull you along in a way that's very, very helpful for kids. So finding that community for yourself and also for your child can be very valuable in reducing stress, anxiety, and potentially medical trauma. But, there's also a place for therapy. And, there's different kinds of therapy. You can have therapy focused on relaxation and mindfulness. There can be therapy focused on psychotherapy, and there can also be medication. So both you and your child deserve to feel better if you're anxious, sad, or traumatized about a medical intervention that's upcoming or that's previously happened. So the one thing to do is talk to your doctor or your school or your nurse and get some recommendations for a therapist that might be helpful. And the two different kinds of therapy that we have pictured here, this one therapy where it's focused on talking and letting the child express their feelings, often that can be very helpful. And the second type of therapy is more of a play-oriented therapy where the child can play out and indicate and express themselves through play. Obviously, you want to find the kind of treatment that would work best for your child. But it's something that kids deserve and that you deserve if you're not feeling okay about it. And you can also talk to whatever professional at the doctor's office or the nurse's office, OT, PT, wherever you were that you got your medical intervention. You can ask them for advice about where to seek help if the child is really upset before, during, or after an intervention. But with this, we're hoping to give you some resources that will be useful for you to use. So with that, Gail, do you have some resources for us?
I do. As I mentioned before, there are a lot of different resources out there to help your child prepare for medical visits and to deal with medical visits. So the first place I suggest you go is our own Boston Children's Hospital website. If you go to the home page, you'll find a search button. It's a little magnifying glass. And if you type in My Hospital Story, you'll come to a page like this that says My Hospital Story. And if you click on that, you'll come to another page which lists the different locations of that the hospital's located at. So Boston's the main campus, and then there's satellites around the Boston area. And let's just start, say we are coming to the Boston Children's Hospital, we'd click that button, and then we'd come to a page that looks like this. And it says when visiting our main campus. And then it has a list. This is just a partial picture of what you see on the screen, but it has a list of all different types of visits that children may have at the hospital. And each of these has a story that goes along with it that is with a real child who goes to that area. They volunteered to be in the pictures, and it starts from them coming into the hospital and what it's like entering the hospital and going up in the elevator to whatever clinic or department they're going to, and then what the child goes through. And so that can be very helpful in preparing your child for a procedure or something they need to get done. But I always suggest, and we always suggest, that parents look over the materials they're going to share with their child before you share with your child, to make sure that you're comfortable with it, because you know your child best, and you know if your child will be comfortable with seeing what's out there. The next way to find materials is going to your local library and asking about children's books about visiting the doctor or the hospital, or you can search it online. I put in children's books about visiting the doctor or hospital, and these all popped up, and there was a long list of them. One of my favorites is Curious George Goes to the Hospital, because that was actually created by the authors in conjunction with some of the staff at Boston Children's Hospital. So that's a really fun book. The other thing you can do is search for a book specific to what your child is if they're getting a cast, for example. I put in books about children with casts, and so a whole bunch of them come up. And so you can check in your local library, or you can order them or look in a bookstore. Bookstores are great because then you get a chance to preview it and see if it's appropriate for your child. But anytime, and also the other place you can do is ask your provider if they have any books that they can recommend, because often they do, especially for specialty appointments like in the ophthalmology department or dentistry. They may have suggestions as well. And finally, our group is the Family Medical Coping Initiative, as we said, and we have a playlist of different webinars that we've given in the past. And there are 3 that I've highlighted here that will help you with some of the details of what we've shared with you. So the first one's helping your child get ready for vaccinations and other pokes, reducing anxiety. That'll give you much, much more details on what to do about that situation. Helping your child overcome anxiety about medical visits. That's a whole program on just that. And then preparing your child for medical procedures. And that's a webinar exclusively on that. And if you'd like to access these easily, you could take a screenshot of this page on your computer, or if you would like to scan this QR code, it will take you directly to the list of webinars that we have to offer. So.
And we just want to say thank you for viewing. We hope that you learned a thing or two about trauma and children and medical care. And as Gail said, we encourage you to go to the Family Medical Coping Initiative playlist on the Boston Children's Hospital YouTube site to see any of our other videos. And thank you, and have a wonderful day.